COVID-19 has been the dominating issue for the past 16 months throughout the world. During this presentation, we look at the difficulty we have endured as a country in getting everyone to work together to help bring this crisis to an end through science-based recommendations. Scientists have told us what to do. A BBC documentary from summer 2020 and an NPR article on print and radio highlight the behaviors that needed to be adopted. If we had followed the directions of masking up, practiced social distancing on a consistent basis, followed guidelines provided by the CDC, we could have avoided the terrible surge that we experienced as a nation in January 2021. Mixed messaging was certainly an issue throughout, but scientists seem to have been drowned by the hyper-political rhetoric and even pulled into the narrative of being the bad guys at times. A paper published by California State University of Irvine suggests that initial confusion regarding mask wearing led to an overwhelming Twitter storm of conspiracy theories when we were told that we should be wearing masks. Although only 10% of over 750,000 tweets were negative and conspiracy theory based, they held most resonance. The research of this same peer-reviewed paper states that even homemade masks would help reduce transmission during inside contact by more than 70% and reduce the mortality rate by up to 80%. Why do people oppose mask wearing? For different reasons, but according to a peer-reviewed paper, Face Masks and COVID-19 Pandemic, the public never regained trust of the government or the CDC because of an on-again, off-again mask endorsement issue early during the pandemic, even though the World Health Organization strongly recommended them. The same article acknowledges the role the media played in endorsing the use of masks and helping to reduce infections as a result. We have been lucky. Effective vaccines were found in record time. But as the Lancet article, What Countries Must Do Now states, cities, states, federal governments, and countries must work together in future to find effective treatments and spread an effective global message. People must also realize that the technology was already developed during the last SARS potential catastrophe with regard to these vaccines. The majority of the work had already been done. The lessons to be learned. Organization must be swift and science must be heard. Facts must be louder than myths. Countries must develop a plan together. States and federal branches of government need to bridge the gap and work together. More education on the necessity for science and following its findings in schools. Consideration must be made of amending the Constitution to criminally charge those who spread misinformation that leads to harm of others. And here are some of the sources that I used for this presentation, and I hope that you enjoyed it.